Thank you, Chris, for that report. Now, the Ministry of Health is now accusing the Office of the Attorney General of seeking to radically change the composition of the National Hospital Insurance Fund, that is NHIF board, by removing representation of key stakeholders. The ministry wants representation from FKE, COTU, KNUT, Kenya Medical Association, and faith-based organizations retained in the NHIF board, in line with the ministry policy of including key stakeholders in boards. The Kenya National Union of Teachers says removing key stakeholders will weaken NHIF's oversight mandate.
And then we come back.
The Statute Miscellaneous Amendment Bill number 13 of 2018 that seeks to change the composition of the NHIF board has been opposed by key stakeholders. The National Assembly's Departmental Committee on Health is scrutinizing changes in the proposed law. The Ministry of Health told members it was not aware of some of the changes in the omnibus bill and wants them readdressed.
That was not something that we had requested for. So we are also puzzled as to the manner in which those particular deletions came by. And that is why in our position we are saying we feel they are important, those stakeholders, and we want to retain them.
We did submit and submitted to the AG as is required of us, but when we saw the published format, we don't know where or how some of that area specifically, the area of the composition of the board was changed. It was a surprise to us.
The Kenya National Union of Teachers says some individuals with ulterior motives want to review the NHIF Act with the aim of changing the composition of its board so that they can easily access and loot the NHIF funds. KNUT argues that to give the Health Cabinet Secretary the latitude to nominate the NHIF board members is suicidal.
Something else that has also challenged our mind is what is this that necessitated these changes? We should get to the deep root cause of what necessitated this.
The ministry was put on the spot over a proposal to remove the Director of Medical Services from the NHIF board and allow the Health Cabinet Secretary to nominate a person of his or her choice.
The DMS has an immense amount of work that the DMS performs in the ministry, and he's represented in very many different boards.
So we don't want to put, if the investor with the manager, that issue never grows.
The ministry wants the board to determine and set the rates of contribution by employer from time to time to eventually match member contributions. However, members say the provision could be abused and want employer contributions to match the employee's contribution.
Those employers' deductions have to be met with benefits. So the current act as is set only talks of employees' deduction, and we set benefits from those employees' deduction.
The government want to make NHIF the vehicle for delivery of universal health care, but questions remain on how national hospital insurance funds are utilized.
NHIF and MINET, we have raised that question and we wanted them to be harmonized, but we hit a brick wall. We were told NHIF is a statutory contribution, so we can't challenge it. And now that the government is insisting the medical allowance should not be given to our members, therefore the employer must look for a provider.
What informs the bills that are given to patients in the hospitals? Because is it how you appear? Is it if Mheshimiwa you come with a big vehicle, the bill changes?
The Minister of Health wants the tenure of Chief Executive Officer of NHIF to be capped at a term of 4 years and renewable ones, subject to their performance. Patrick Amimo, KTN News.
Thank you, Patrick Amimo, for that report on the NHIF board round. Now, joining us by way of phone this morning on the show is Francis Atwoli. Mr. Francis Atwoli is the COTU Secretary General. Mr. Atwoli, good morning and welcome to the program. And apparently the Ministry of Health, while appearing before the Health Committee, they're saying that they're not behind the draft bill and have not proposed for your removal. I mean, who is targeting COTU, FKE, the Kenya Medical Association, and why?
This is the same person who targeted NYS and other scams that are bedeviling our country, Kenya. Because in any normal thinking of any normal person, a contributor who is the majority on NHIF is a worker, assisted by employer for facilitation purposes. The same at NSSF. And the law is very clear on those ones. And to make it worse, this should also be fixed to the new constitution, Article 41, on how one should join an association is through his own willing, his own volition, freedom of association. So you cannot, where somebody is contributing, it's a social partner or a stakeholder, you come up with some senseless proposals that we cannot sit on that board. If we cannot sit on that board, read the constitution properly. We will pull out. If we pull out, what will happen when the government requires to provide universal health care to every Kenyan? They need our support. They need the support of every Kenyan.
Yes, well said, Mr. Atwoli. Now, apparently, NHIF collects about 30 billion Kenyan shillings from workers annually. And what are you reading in this? Are you seeing some sort of, where will this leave NHIF as far as transparency is concerned, even at a time when the Ministry of Health is distancing themselves from, suspending you people, and they are now laying blame on the Office of the Attorney General?
Let me tell you, that will not happen because it is unconstitutional, unacceptable, and if we move to any court and we appear even before a newly appointed judge, we will still stop that nonsense, and that law will be annulled. That one I'm 100% sure, because you cannot push out a contributor under what circumstances, and you cannot suspend a law or amend a law without public participation. We have not been invited as social partners or stakeholders to give our views. Employers have not been invited per se, and all other people who are contributing. It must be debated before just one wakes up from the wrong side of his bed and he comes to say this is what we are proposing, because he wants to put there people whom he will direct or tell them where the money should go. And this is what I said sometimes back. I said what you are seeing now. I said it in 2014 at Tom Mboya Labour College, that this is the only country where a senior person in government, either elected or appointed, can call a junior procurement officer and direct him who should be able to get this tender. And after 2014, this is another, after 4 years, is when Kenyans are realizing what I was telling them is true.
One final question, Mr. Atwoli, for you. Apparently, it's not just COTU that is being targeted in that NHIF board. Apparently, the FKE, that is the Federation of Kenya Employees, the Kenya Medical Association, even faith-based organizations are being targeted. So, do they share the same point of view as you?
FKE, the Kenya Federation of Employers or Federation of Kenya Employers, is registered as a trade union. And the same with KNUT and KUPET. And also, faith-based organizations are from the churches. And churches stand for the truth. And Kenyans, 99% of our Kenyan leaders are thieves. And no NHIF would like to have, any sanity in an organization, apparently. We are supporting the president and his team. We are supporting the director of investigation, the CID. We are also supporting the new DPP to make sure that these people are removed from our meetings. These are the same people who are proposing these things. It is not even AG, it's not the ministry, it is not us. There has been an outcry on representation on these boards. Who is this individual coming up with these proposals if it's not a thief?
Brother Atwoli, one final question. What is the recourse if this goes through? And perhaps who are being, who are these individuals who are supposed to replace, the likes of COTU and the FKE on the board?
They will come out. Let them come out faster and we know what to do. For example, you heard they were doing, they made a good amendments. The government gazetted their representatives at the NSSF. When one of COTU's representatives' term expired almost a year ago, and we asked them to gazette her, up to now they have not gazetted. Who is this advising government on these two boards? That is NSSF and NHIF. Let them raise up their head. We have already put mechanism in place. We have about 5 attorneys in place awaiting that bill to go through, and they move to court.
One final question, once again, Mr. Atwoli. What is the objective of, you being targeted? I've already told you the figure of about 30 billion shillings that the NHIF collects annually from workers. Does it mean the government wants to have a firm grip on this fund?
That is the thing. They want to spend the money they want to spend. Nowadays, government doesn't want to hear there is money here or there. They are targeted. It is not government actually. Individuals in government. This is how it should be, not government per se, because the president is against it, and other good-loving Kenyans in the government are against it. There are some individuals who are very powerful, but Kenyans are narrowing down on them. When I come back at home, I'm now in Geneva, because even here at the ILO Convention number 144, which is on tripartism arrangement, tripartism is government, employers, and workers. It clearly says no any amendment, no anything touching to a worker employer or a ministry in charge of industrial relations practice or labor policies without prior consultation. Why can't those people in the ministries know this money belongs to workers? And we must consult them, we must have a debate with them, we must give them our proposals and reasons why amendments should be done. And such huge, big amendments cannot be carried into miscellaneous amendments. Because miscellaneous amendments are where you are correcting commas, full stops, and so on. You don't bring a full-fledged law, and then you say this is what is within a miscellaneous amendment without asking for public debate and public participation. That is why I'm telling you that is not something which is going to see the light of the day. That one I'm 100% sure. I've been around for some time, and I know for sure and for really that they will not succeed.
Thank you very much, Mr. Francis Otwole. There, of course, that is the COTU Secretary General, Mr. Francis Otwole, coming to us by way of phone all the way from Geneva, Switzerland, talking about the NHIF board row at a time when the Ministry of Health has already, distanced itself from that move, saying that they're not behind the draft bill and have not proposed the removal of not just COTU, but the Kenya Medical Association, religious-based organizations, as well as the FKE from the NHIF board. Of course, that is a story that we're still